Okay, so hello everyone. My research question deals with the television reality show Extreme Makeover. And the premise behind the show is that it's a makeover reality show where women submit themselves to undergo an extreme makeover that is plastic surgery. So one of the things that I thought would be interesting to look at on the show is the language used by the patient and the doctor. How do both of these aspects of the show ultimately relate to what the surgeon's role is in plastic surgery? Because most times when people think of a surgeon, they think of someone that's fixing a problem or healing a person. But people who are having plastic surgery don't really have like a medical problem that's going to kill them. It's what is the role of the surgeon here that they will be fixing. So the first thing I looked at was the language of the patients before and after their surgery. And noticing just from the terms that I gave on the handout, they point out to things that they don't like, but it's nothing like very specific. Like they notice a bump on their nose, they notice skin hanging from their chin or around their eyes. Sayings like their face is short and wrinkled or their face needs to be tweaked. Kind of just give like an overall appearance that they don't like. It's nothing very specific. And then afterwards, in all the episodes that I watched, only did one person specifically point out a feature of their face that they thought was better. And the thing that they said was their nose is cute. Everything else was, they look the absolute best they ever have. She feels like Cinderella and she felt overall more confident. So nothing here specifically points to something on their face that has been improved. So from the beginning you can see that all of the words, or all of the phrases that the patients use to describe how they feel portray negative and unattractive aspects of their body. And then afterwards, they fail or they don't specifically point out what they like. This is ultimately left to the surgeon. Whether or not this is how the patients see the surgeon's role is left up to them, but ultimately the way that the surgeon describes their look afterward is much more specific. So typically the surgeon's role does not involve masking unattractive qualities and improving confidence level. It usually revolves around fixing and healing of a problem. So the concept of doing no harm is really put into play here because these patients don't need this surgery. It's elective, and essentially the surgeon is doing harm to these patients when it's not needed. So then, looking at the language of the surgeon, one of the things that I thought was the most interesting aspect was how they greeted the patient when they first initially made contact. So phrases like, how can I help you today? What is the main thing that brings you in today? And what are the things that motivate you and bring you in today that you would like to talk about? It's really interesting that the surgeons avoid a negative situation in this sense. And these phrases ultimately help the patient feel more comfortable, even though the surgeon clearly knows why the patient is coming to them. These phrases just help the patient feel more comfortable and will help the patient tell the doctor what they don't like. So once the patient has told the doctor the problems they see with their face, the doctor kind of sort of improves upon what the patient is saying and furthers that negative aspect of what they're saying. So like the patient said, I have skin hanging from my chin. The doctor then describes it as extra skin with modest fat in the chin, furthering the notion that, yeah, you do have a problem with your chin, like, and this is what the problem is. Other things like frowners around the mouth and fat on the upper eyelids that relate to the disconnect from the age are all like ultimately trying to convince the patient that these are the things that you see are wrong and these are the things that I see as wrong relating to what you are telling me. So afterwards, the language you can see is a lot more specific from the surgeon's point of view. like the eye area is rested, alert, and youthful. There's distinct definition. Things are being more optimal, things like that. And one of the things that the language of the surgeon really brought to light for me is it seems as though they're trying to sell their services to the patient. It seems as though, the patient is saying they have something wrong with them. The doctor is then furthering that assessment and being like, yeah, you do have something wrong with you. Here's why I can help you. Here's how I can help you. So the role of the surgeon, again, is called into question. What is the role of the surgeon in this situation? Well, it seems as though they're like a networking tool. They're trying to do a business transaction. They are trying to sell their services to the patient. And so for my further analysis, I thought it would be interesting to interview a plastic surgeon. And the one I interviewed was from Southern California, where the show takes place. And the interesting points he said were that the majority of his patients receive plastic surgery because they are unhappy with some aspect of how they look. And then he classified patients into 3 categories. One being as someone who was unhappy with their looks. 2 being as someone who's lost a lot of weight and they need a special procedure, which I didn't really deal with. And then 3 is people who are just kind of crazy and they're doing it to improve something that they think keeps needing to be improved upon. And it was interesting to me because this doctor kind of furthered the point of the initial relationship being made between the doctor and the patient. Because he said when he usually meets someone, he asks, so what brings you in today? And it's interesting to see that he too is trying to create a positive environment and not use negative phrases. So ultimately, I think that the language of the doctor and patient kind of reveals hidden agendas of both. And looking at the patient and the patient's language and the general aspects of it, and the more specific aspects of the surgeon's language and how they further the things that the patient thinks about themselves, kind of relates to this whole networking aspect of how ultimately the surgeon is just trying to sell his so-called product.
Thank you. Questions? Well, I have a couple questions. So you mentioned how the patients leave it up to the doctors to describe what the product looks like. Could you, I guess, talk more about this? Why do you think that is?
I think part of it is that the patient just doesn't really know what specifically about their face they don't like. They can point out specific features, they don't like their nose or they don't like how their eyes look. But the doctor is ultimately the person that is, furthering what they say. Even if the doctor might not agree, I don't know if the doctor agrees with it or not, but he's ultimately saying you do have bumps on your nose. And I think part of the reason is because the doctor is someone that's experienced and knowledgeable about the subject, and hearing the patient hearing the doctor say what they think is wrong with their face relates to how the patient will feel and how they will also think that.
So I guess, would you say that even if the surgery wasn't that successful, that if the surgeon was oh, it looks
good, that the patient will?
Yeah.
An interesting fact is the surgeon I interviewed said that most of the time the patient, even if the surgeon doesn't think the procedure was successful, if the patient feels better in the end and the patient feels that they think that a good job was done, then that's how it is. The doctor I interviewed told me that sometimes he thinks that the patient will come back to him in a few months saying can you fix this? I don't really think that the best was done that could be done, but they actually end up loving it. And he said a lot of it relates to the personality of the patient and how they feel before, and then when they see afterwards what has happened, if they feel it has improved, then that's just how it is.
Just last question. So you mentioned how kind of the surgeons are selling essentially their what they do. So do you think that